Good old cognitive distortions. We all got them. 10 of the most common cognitive distortions. Here we go. Polarized thinking, sometimes called the all or nothing or black and white thinking. This distortion occurs when people habitually think in extremes. When you're convinced that you're either destined for success or doomed to failure, that the people in your life either angelic or evil, you're probably engaging in polarized thinking. This kind of distortion is unrealistic and often unhelpful because most of the time reality exists somewhere between the two extremes. Overgeneralization. When people overgeneralize, they reach a conclusion about one event and then incorrectly apply that conclusion across the board. For example, you make a low score on a math test and conclude that you're hopeless at math in general. You have a negative experience in one relationship and develop a belief that you just aren't good at relationships at all. Overgeneralization has been associated with post-traumatic stress disorder and other anxiety disorders. Catastrophizing. This distorted type of thinking leads people to dread or assume the worst when faced with the unknown. When people catastrophize, ordinary worries can quickly escalate. For instance, an expected check doesn't arrive in the mail. A person who catastrophizes may begin to fear it will never arrive, and that as a consequence, it won't be possible to pay the rent, and the whole family will be evicted. It's easy to dismiss catastrophizing as a hysterical overreaction, but people who have developed this cognitive distortion may have experienced repeated adverse events like chronic pain or childhood trauma, so often that they fear the worst in many situations. Personalization. One of the most common errors in thinking is taking things personally when they are not connected to or caused by you at all. You may be engaging in personalization when you blame yourself for circumstances that aren't your fault or are beyond your control. Another example, when you incorrectly assume that you've been intentionally excluded or targeted. Personalization has been associated with heightened anxiety and depression. Mind reading. When people assume they know what others are thinking, they are resorting to mind reading. It can be hard to distinguish between mind reading and empathy, the ability to perceive and understand what others may be feeling. To tell the difference between the two, it might be helpful to consider all the evidence, not just the evidence that confirms your suspicions or beliefs. At least one study has found that mind reading is more among children than among adolescents or adults and is associated with anxiety. Mental filtering, another distorted thought pattern, is the tendency to ignore positives and focus exclusively on the negatives. Interpreting circumstances using a negative mental filter is not only inaccurate, it can worsen anxiety and depression symptoms. Researchers have found that a negative perspective of yourself and your future can cause feelings of hopelessness. These thoughts may become extreme enough to trigger suicidal thoughts. Crazy. Discounting the positive. Like mental filters, discounting the positive involves a negative bias in thinking. People who tend to discount the positive don't ignore or overlook something positive. Instead, they explain it away as fluke or sheer luck. Instead of acknowledging that a good outcome is the result of skill, smart choice, or determination, they assume that it must be an accident or some type of anomaly. When people believe they have no control over their circumstances, it can reduce motivation and cultivate a sense of learned hopelessness. My favorite, should statements. When people find themselves thinking in terms of what should and ought to be said or done, it's possible that a cognitive distortion is at work. It's rarely helpful to chastise yourself with what you should be able to do in a given situation. Should and ought statements are often used by the thinker to take on a negative view of their life. These types of thoughts are often rooted in internalized family or culture expectations, which might not be appropriate for an individual. Such thoughts can diminish your self-esteem and raise anxiety levels. Emotional reasoning. Emotional reasoning is the false belief that your emotions are truth, that the way you feel about a situation is a reliable indicator of reality. While it's important to listen, validate, and express emotion, it's equally important to judge reality based on rational evidence. Researchers have found that emotional reasoning is a common cognitive distortion. It's a pattern of thinking that's used by people with and without anxiety or depression. Labeling. Labeling is a cognitive distortion in which people reduce themselves or other people to a single, usually negative, characteristic or descriptor, like the drunk or failure. When people label, they define themselves and others based on a single event or behavior. Labeling can cause people to berate themselves. It can also cause the thinker to misunderstand or underestimate others. This misperception can cause real problems between people. No one wants to be labeled. So, how can you change these distortions? Well, the good news is that cognitive distortions can be corrected over time. Consider cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, is a widely recognized form of talk therapy in which people learn to identify, interrupt, and change unhealthy thinking patterns. If you'd like some guidance in identifying and changing distorted thinking, you might find this type of therapy useful. CBT usually focuses on specific goals. It generally takes place for a predetermined number of sessions and may take a few weeks to a few months to see results. Look for a therapist who properly is certified and licensed in the state where you live. Your therapist should be trained in CBT, so try to find a therapist who has experience treating your type of thinking pattern or issue. The bottom line, cognitive distortions are habitual ways of thinking that often are inaccurate and negatively biased. Cognitive distortions usually develop over time in response to adverse events. These are at least 10 common distorted thinking patterns that we've talked about today and have been identified by researchers. If you're ready to tackle a cognitive distortion, you may want to try some of the methods found in cognitive behavioral therapy. This type of therapy has been successful in helping people identify cognitive distortions and retrain themselves to look at the world in a clearer, more rational way.